My name is Dr. Monteverde Diaz, and together with Dr. McDonald, Dr. Sam, Dr. Pastrana, and Dr. Mohan, we'll be presenting a rare case of invasive, poorly differentiated squamous cell carcinoma of colon, which arrived to our hospital, Palmetto General. As you may or may not be aware, primary squamous cell carcinoma of colon is an extremely rare disease, which represents 0.5% of all colorectal tumors, and with a reported incidence of 1%. Here, we present a case of a 63-year-old Hispanic male with a past medical history significant for non-insulin-dependent diabetes mellitus and with episodic rectal bleeding since last year, whom had presented to the emergency department, reporting left gluteal pain and discomfort for 2 weeks. Initial CT imaging showed a left ischiorectal fossa phlegm developing abscess, for which general surgery was consulted for an incision and drainage of the abscess. During the procedure, digital rectal examination revealed a left lower rectal ulcerated irregular mass, which measured 2 centimeters and was located above the dentate line, which extended into the rectal sigmoid junction. Multiple biopsies were taken during this procedure. Pathology showed invasive, poorly differentiated squamous cell carcinoma, basaloid type, or otherwise known as cloacogenic carcinoma, which was positive for CK5-6, P16, and P40 tumor markers. Patient then underwent colonoscopy with further biopsies of the colon. A laparoscopic assisted transverse loop colostomy was performed with careful care to have negative margins. Afterwards, the patient underwent chemoradiation therapy for further management of said rare malignancy. Under the figure tab, we can see images from the colonoscopy where we can appreciate the malignant lesions and see irregular margins, raised borders, erythema, and bleeding. As previously mentioned, primary squamous cell carcinoma of the colon is an extremely rare presentation of colorectal cancer, which accounts for an estimated 0.1 to 0.5% of colorectal carcinomas in general. Given the rarity of this rectal carcinoma, there is limited information regarding its presentation, risk factors, causes, management, and prognosis. There are very few risk factors described in literature which have been associated with primary squamous cell carcinoma of the colon. These include ulcerative colitis, Crohn's disease, HPV, smoking-induced de novo mutations, HIV, and enteric infections including amoebiasis or schistosomiasis. Certain criteria have been described in order to categorize the suspected carcinoma as a true primary squamous cell carcinoma of colon. These include metastases from other potential sites must be ruled out, a squamous lined fistulous tract to the bowel must be ruled out, squamous cell carcinoma with extension into the colorectal tract must be ruled out, and finally, histopathology must confirm the presence of primary squamous cell carcinoma of the colon. Our case met with the aforementioned criteria. Patients diagnosed with primary squamous cell carcinoma of the colon present in a similar fashion to other types of colorectal carcinoma, which include weight loss, fatigue, fevers, night sweats, and rectal bleeding. Interestingly, since it's a rare disease, there is no consensus in terms of staging and management. In our patient, similar to other cases, surgical resection with negative margins followed by chemoradiation seems to be a popular management option among colleagues. In conclusion, primary squamous cell carcinoma of the colon is an exceptionally rare disease. There is limited information regarding clinical manifestation, risk factors, treatment options, management, and prognosis. Hence, the importance of describing these cases for better clinical outcomes. As listed below, there are references. We thank you for your time, and we hope that during this presentation we learned a little bit more about this rare cancer. Thank you.